Hi, I'm Dr. Denise Hill, and I'm Senior Lecturer of Sport and Exercise Psychology at Swansea University, and I'm part of the Elite Sport Performance Research Centre. And I'm just going to talk briefly through one of the projects that I'm leading at the moment as part of that centre, and that is looking to explore how to maintain and protect the well-being and mental health of athletes and support staff within the performance sports setting. So this PhD is funded by the university and supported by Sport Wales and the Welsh Institute of Performance Science, and is being co-led by one of my PhD students, Georgia Brown. So we started this project about 6 to 8 months ago because there was growing recognition that elite athletes may be struggling with their mental health and well-being. Excuse me. And up until that point, it was quite interesting, really, that there was an assumption that elite athletes, in comparison to the general population, probably had higher well-being and better mental health because they were mentally tough, because they obviously trained and exercised regularly, and they had coping strategies that they developed through their training and competition, and all of these things were associated with higher well-being and better mental health. So yeah, there was assumption that elite athletes would be better placed than the general population. But through growing number of stories and anecdotal accounts from athletes and initial research, it appeared that actually elite athletes are as vulnerable to low well-being and poor mental health as the general population, and more work, more research and more support was required. And that's where Tanny Grain Thompson led the Duty of Care report, which looked at these issues, well-being and mental health amongst athletes, and concluded that all sporting governing bodies needed to develop a mental health strategy that protected their athletes' well-being and mental health going forward. And actually, initial research in this area showed that there's certain times when elite athletes may actually be vulnerable to quite poor mental health and well-being. When they retire from sport, when they're injured, when they experience failure, when they're experiencing an overloaded training and competition. And those that are in lean or weight category sports, such as boxing, may also be higher in vulnerability to poor well-being and mental health. And also, it's been noted that there may be high stigma in elite athletes regarding mental health. So that means there may be a reluctance of athletes who are struggling with their well-being to seek support for fear of being judged as mentally weak and the negative connotations and repercussions that they fear may come of that. So because they don't seek support, it may be that poor mental health then progresses and develops into more serious mental health concerns. So the initial research shows that there is more research that needs to be completed in this area in order to understand fully the factors that affect the mental health of elite athletes and what can be put into place to support the mental health of athletes and to inform the mental health strategy that sporting governing bodies need to have in place. And that's ultimately what this project is trying to do with Welsh sport. So we're looking to identify through the key focus performance sports in Wales, the risk factors that can affect well-being and mental health of individuals within the performance setting, and then also any protective factors that can increase, improve or maintain the well-being of athletes and individuals within the performance sports setting. And I say individuals because it's not just about the athletes that we're looking at. So it might be really surprising to hear that a lot of policy and research has been focused almost entirely on athlete well-being and mental health. And that's right to a point, but we seem to have overlooked the people who are supporting the athletes, the team behind the team, and their support staff in terms of coaches and sports science practitioners. And it's surprising they've been overlooked because they are having to perform under pressure as well. They are under incredible demands, incredible pressure. They have to perform if they don't perform and their athletes don't perform, then job insecurity is there for them. They spend a lot of time away from their family at major events and so on and so forth, just like the athletes. And so it could well be that there is things that need to be done to support the well-being and mental health of the support staff as well as the athletes. So this project is looking at both athletes, coaches, and the sports science practitioners, so athletes and support staff across multiple performance sports in Wales. And this work then is intended to inform the mental health strategy at an organisational level of those sports, and also to develop individual level wellbeing and mental health programs and interventions that can support athletes and support staff going forward. So that's our aim. The project has started. We have started collecting quantitative data. So we're using a survey to measure well-being, psychological distress, so mental health indicators, and also mental health literacy, which is individuals' attitudes towards mental health and help-seeking behaviour, which is associated with well-being in its own right. So we're looking to collect quantitative data over time so that we can see changes to well-being across the athletes and support staff, when well-being goes up, down, and why. And we're also collecting qualitative data, so we're really understanding those protective and risk factors of well-being and mental health. And we're doing this through several ways to make sure that this data is robust as possible. We're observing, we are using interviews, we're using focus group, we're using electronic diaries. So we're triangulating data from several methods, several sample groups to make sure that we have a really robust understanding of all of the factors that can maintain, protect, or risk the well-being and mental health of athletes and support staff. At very early stages, early indications though, I'm happy to share with you. And so certainly the well-being of the support staff, the coaches and practitioners across sports seems to be affected by the same kind of things, which is the organisational culture in which they work, the leaders that are driving that organisation, their style, the workload, not necessarily the amount of work, but the type of work that they're being exposed to, the amount and quality of social support that they have access to, the individual's coping style. Lots more work to be done to flesh that out though, of course. The well-being of the athletes, our initial data, we can't reach any conclusions as yet, but what we have noted is that it's far more complex, far more sport and context specific and dependent. Also, for sure, what's coming through is the relationship between the coach and the athlete is important in terms of well-being and mental health outcomes. And again, social support in terms of emotional support from their friends and their families, but also informational support in terms of guidance from their coach and their sports psychologist, and the rest, but certainly very, very early days. So we're excited to continue this work now for the next couple of years, which should culminate in an intervention and inform the mental health strategy. So if there are any questions you have on this project as it develops, by all means, please feel free to contact us. Thanks for your time.